So good evening, everybody.
Well,
Glad you guys can join us. So I've got Glen Foley with me today. He's a colleague of mine. He's a podiatrist, and he works with me at Sportswise in Eastbourne, but he's also got his own clinic in called the South Downs Podiatry and Chiropractic Clinic. So Glen, I'm going to let you introduce yourself and tell us more about you and what skills you have.
okay, thanks, Marika, and thanks for inviting me along tonight. Thank you everyone for tuning in, and hopefully we'll be able to give you some answers to the sort of problem it is the bunion, and it's been a real constant in my clinic ever since I've started MSK Podiatry 15 years ago. Probably the most prevalent condition that I see in runners, particularly female runners, behind plantar fasciitis and Achilles tendinopathy. So I guess what is a podiatrist is probably the best place to start, Marika.
Yeah.
So podiatry basically is somebody who looks and is interested in the health and well-being of people's feet. Not only their feet, obviously, but the effect that their feet can have on their overall life and the effects that can have. Be that runners, people who are elderly, or children. We cover the whole remit from children through to elderly. So our conservation of the health of people's feet is paramount to podiatrist work, and that can range from something as simple as cutting someone's toenails. And runners amongst you will know that toenail problems are incredibly prevalent amongst you, and particularly if you do have bunions, which I guess is why a lot of you are tuning in tonight. And we'll come on to that a little bit more detail later on. Podiatry also covers surgical intervention. So we have pediatric surgeons. Our main role within the NHS is musculo-skeletal, but predominantly is the at-risk foot. So dealing with people with poor circulation, diabetes, rheumatoid arthritis, where they're at severe risk of losing their foot or their entire limb as a result of complications from poor foot health. So in a nutshell, I guess the simplest way of describing a podiatrist is a foot health expert. My particular area of interest is musculo-skeletal and biomechanics, and basically that covers the way that you use your feet, how you move over your feet, and how that integrates with the rest of the kinetic chain. The foundation of the way we move is obviously from the feet, but both ends of the chain can affect one another. So the feet can affect something further up the body, and vice versa, something further up the body can affect the feet. So that's why we work very closely with physiotherapists, sports medicine doctors, osteopaths, chiropractors, and there's a lot of crossover in our work. And I'm lucky enough to work with a great team at Sportswise, particularly Marika, and we share, I've got to say, Lex, you invited me here tonight, and we share a lot of patients together to try and get the best outcome for those patients. Musculoskeletal podiatry, basically we use video gait analysis, we use physical assessment, we look at muscle strength, we look at neurodynamics, i.e. how the nerves affect the movement patterns within the body, and mainly a lot of people come to see us for pain. So we also look at the cognitive side of pain as well as the physical side of pain. So it's a huge area. I've been doing it for 15 years now. I worked with British Athletics for 2 years as a consultant podiatrist. I've worked at GLMRC Headley Court, which is a defence medical research and rehabilitation centre for the military, and we deal with everything from IED blasts through to the elite athletes who represent the Army, Navy or Air Force. So it's quite a large remit of my work, and I think, as Marika mentioned, I have 2 clinics I work for in Eastbourne as well.
Yeah, and what I found interesting, what I found interesting when I first started working with you was the number of patients that I sent to you, which I thought would get orthotics, and the number you sent back saying, no, they need strengthening up. So I think that's a part of podiatry that I didn't actually, I don't think I understood how much you guys understand about the body and how the muscles and things affects it. And how it's not just orthotics for everybody. Orthotics isn't the right thing for everybody. How you actually end up strengthening people up more often than not.
Absolutely. I think probably in the olden days, we did prescribe an awful lot of orthotics. But as our profession has sort of gained greater understanding with the sort of advent of better technology, such as the Vicon systems, pressure analysis, ultrasound analysis of muscle movement as we move, I think, you know, we realise that there is life above the ankle for sure. And you know, so orthotics, they play a part in rehabilitation, but they are not the magic sort of wand that you can wave over people and cure everything. And probably we have been guilty of thinking that in the past, but now as research has shown us, you know, strength and conditioning, movement patterns, you know, cognitive therapy, and multidisciplinary approach to patient care is absolutely key to getting the right outcome.
Yeah, I think I would be safe to say that 15 years back you wouldn't hear podiatrists speak about cognitive therapy.
All physios, to be fair.
No, exactly.
I think, you know, I speak on behalf of all of us, Maria, all of the healthcare professionals. Yeah. We don't care who gets you better. We just want to do what's best for the patient. And it's key that, you know, we share information and work closely together, and that's definitely what we've learned to do over the years, I think.
Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.